Hello, my name is Anthony Johnson, and welcome to my talk on the surveillance of respiratory exposures and diseases among agricultural workers in the central states of the United States. Agricultural work is hazardous. This type of work often places farmers and farm workers directly face to face with a variety of hazards that can potentially cause harmful effects to their respiratory systems. Many of the hazards that farmers and farm workers encounter have been associated with increased rates of respiratory disease. The Central States Center for Agricultural Safety and Health initiated a surveillance program in 2011 for agricultural injuries, but in 2018, the annual survey was modified to include questions not only on the agricultural injury but also chronic illnesses, work exposures, and protective practices. ISASH, in conjunction with Farm Market ID, which is a commercial service for agricultural marketing, were able to obtain a dataset containing 22,440 randomly selected farms in the Central region. The Central States region consists of the following states: Iowa, Kansas, Minnesota, Missouri, Nebraska, North and South Dakota. We collected a total of 4,657 usable responses from survey participants, which is a response rate of nearly 20%. In the current study, we are interested in respiratory disease. We define respiratory disease by the survey question: has the operator ever been diagnosed by a physician with any of the following respiratory conditions? The outcome in this report was defined as a positive yes or no response to any of the respiratory conditions, which included asthma, farmer's lung, sinus disease, nasal inflammation, runny nose, and environmental allergies. We excluded chronic obstructive pulmonary disease, which is considered primarily a smoking-related condition versus a condition related to work exposure. Respiratory diseases may result from high levels of agricultural exposures to organic and inorganic particles, gases, chemicals, biologic agents, and other toxicants. Concentrations from these exposures depend on farmers and farm workers' farm-related activities, which include planting, maintenance, and harvesting of crops, tending of livestock, and the repair of farm buildings and fences. The aim of this study was to evaluate respiratory health risks associated with occupational exposures among farmers and farm workers regularly involved in agricultural activities. In our study, respiratory disease counts by states from highest to lowest were Nebraska, Iowa, North Dakota, Minnesota, South Dakota, Kansas, and Missouri. Agricultural workers who had been diagnosed by a physician with at least one respiratory condition in our study represented 19%, or 807, of the total number of participants. Those who reported not having any respiratory condition represented 81%, or 3,339 of our total study population. Previous reports have found that there is a low prevalence of respiratory diseases. To not be common, the prevalence of respiratory disease in risk populations like farmers and agricultural workers does not generally exceed 1%, and it would have been unlikely to occur in a study of this size. This surveillance fills a gap as no other surveillance exists to provide similar information. Only hired workers on large farms are covered. The findings in our study indicate that respiratory disease were prevalent among at least 1/4 of self-employed farmers and ranchers in the Central States region. These findings in our study reaffirm that the need for intervention strategies to address respiratory exposures in order to reduce respiratory disease among agricultural workers in the Central State region is needed. The results of our study could be used for designing interventions and targeting towards specific populations at risk.